Welcome to the deep dive. We take heaps of information, boil it down, and give you the essentials. It's basically your shortcut to getting up to speed on complex stuff without, feeling totally swamped.
And today we're tackling something really fundamental for making healthcare better. Stakeholder engagement. We've gathered insights from all over, Joint Commission International, Supremediq Consultancy, iSquaw. We even got a look behind the curtain from the QI Playbook podcast, plus a pretty detailed research study.
Exactly. So our mission today, to really explore why getting the right people involved isn't just like a nice thing to do. It's absolutely crucial for making changes in healthcare that actually work and, importantly, last. Okay, let's jump in. When we say stakeholders in a healthcare quality improvement project, who are we actually talking about?
Okay, good question. So stakeholders in this context are really any person or group who's affected by whatever the project is,
right,
or who could affect its outcome. And the QI Playbook pointed out it's a really mixed bag. You've got the obvious folks like doctors and nurses.
Sure, the clinical staff.
Yeah, but it also includes, say, the front desk team, patients themselves, their families, hospital administrators, people in finance, IT, even external regulators count. It's quite broad.
No, it really is a wide range of people, but why is it so important to involve all these different groups? What's the big deal about stakeholder engagement?
Well, the benefits are pretty huge, actually. When you bring stakeholders in early, like the QI Playbook stressed, you get their buy-in. That's critical. It cuts down on resistance to whatever change you're trying to make.
Which makes sense, right? If you helped build it, you're more likely to support it.
Exactly.
Yeah.
And, involving people who are actually doing the work or experiencing the service often leads to solutions that are just more practical. They work better in the real world.
Because they know the ground reality.
Precisely. And ultimately, it fosters this sense of ownership. People feel like it's their project too, not just something handed down.
Yeah.
So yeah, it's not just about being nice. It builds support, gets you better solutions, and makes improvements actually stick.
That really clicks, that feeling of this is ours. So conversely, what happens if you don't do this well, if you don't engage people effectively?
Well, the big risk, and the QI Playbook was clear on this, is that even a really well thought out plan, it can just fail.
Fail how?
It just doesn't get off the ground, or it doesn't get used properly. If the people who have to implement it or live with the changes aren't on board or don't understand why it's happening, it's likely to fizzle out.
Okay, so breaking it down further, who are the kind of key players we need to think about engaging in these QI projects?
The QI Playbook actually gave a helpful breakdown. First, you have your core team. These are the people leading the project, like the quality officers, maybe a department head.
The project drivers.
Right. Then there are process owners. These are the folks directly responsible for the specific thing you're trying to improve. Think like the nursing team in charge of discharges, if that's your focus.
Got it.
Then you have influencers. They might not be hands-on with the process, but they can definitely affect its success. IT could be one, or HR, or finance.
Okay, they hold certain keys.
Exactly. Then decision makers. That's your leadership, the execs who give the final go-ahead or allocate resources. And lastly, end users. Crucial group. Patients, caregivers, maybe junior staff who interact with the new system or process day to day.
That's quite a few categories. It feels like you can't just treat everyone the same way, engagement-wise.
Yeah, absolutely not. And that's a key point. Engagement isn't just, send out an email blast. It's about involving people.
Actively involving them.
Yes.
Yeah.
And the QI Playbook talked about 4 levels, borrowing from this framework called IAP2. Yeah, International Association for Public Participation. It helps you think about how much involvement is needed. Level 1 is just inform, keeping people updated. Maybe finance just needs updates.
Okay, just keep them in the loop.
Right. Level 2 is consult. You're actively asking for their input, their suggestions. Maybe you consult nursing teams on a new protocol.
So seeking feedback.
Then there's involve. Here, they're part of the actual decision-making. Maybe department leads, helping choose parts of a new IT system.
More hands-on.
Definitely. And the highest level is collaborate empower. This is where key people might co-lead parts of the project, really take ownership. Think of like clinical champions driving a safety initiative.
That framework seems really useful for planning. So what's the trick to actually making this work on the ground?
The absolute key, emphasized again in the QI Playbook, is identifying these stakeholders early, like right at the start.
Before you get too far down the road.
Exactly. Knowing who's who from the beginning lets you plan the right level of engagement for each group and make sure you're using everyone's time effectively.
Okay, so identify early, But then how do you decide who gets, say, involved versus just informed? How do you prioritize?
Good question. There's a tool for that, actually. The QI playbook mentioned the stakeholder matrix. It's pretty neat.
A matrix. How does that work?
It helps you prioritize based on two things: how much influence or power a stakeholder has over the project,
Okay, power.
and how much interest they have in it, how much they care about the outcome.
Influence and interest. Okay, so you plot them out.
Yeah, basically on a grid. It gives you 4 boxes. Top right, you have high influence, high interest. These are your key players. You need to engage closely with them. Think department heads who are crucial and really care.
Makes sense. You're champions.
Totally. Then high influence, low interest. These folks have power, but maybe the project isn't their top priority. Your goal: keep satisfied. Maybe the CFO needs to approve the budget, but isn't in the weeds.
Right. Keep them happy, address their concerns.
Exactly. Then, low influence, high interest. They might not have a lot of power, but they're really invested. Maybe junior doctors keen on seeing better patient flow. For them, you keep informed and motivated.
Let them know their interest is valued.
Yes.
Yeah.
And finally, low influence, low interest. These need minimal effort, but, don't ignore them completely. Just basic updates might suffice.
That sounds like a really practical way to focus your energy. Can we maybe look at an example, see how this plays out in practice?
Yeah, definitely. The QI playbook had a great case study from a place called Royal Lotus Hospital. They were trying to fix delays in their operating rooms.
Or delays, yeah, common problem.
Very. So initially they focused mostly on the surgeons and the anesthesiologists, which, seems logical, right? They're right there.
They're central to the process.
But the delays just kept happening. They weren't really making headway.
So what were they missing? Who else needed to be involved?
The breakthrough came when they widened the net. They started engaging the cleaning staff.
The cleaning staff. Interesting.
Yeah, the ones who turn over the ORs. And the transport team who move the patients. And the scheduling office.
All those other crucial steps.
Exactly. And talking to them revealed bottlenecks they hadn't seen before. Things like delays in getting beds transferred or issues in pre-op prep that the surgeons just weren't aware were the main drivers.
Wow. So the problem wasn't where they initially thought.
Not entirely, no. And the result. By bringing all these different stakeholders into the conversation, they cut their OR turnaround times by 40%.
Okay.
40%. In just 3 months.
40%. That's huge. Just by talking to more people.
Pretty much. It just shows you really need that full picture.
That's a fantastic example. It really hammers home that point. Now, the QI playbook also had an interview, right? With a QI leader.
Yes, it's Dr. Meenal Rothi. She leads QI at a teaching hospital and talked about a big project she ran on improving patient discharge times, another common headache.
Oh, yeah, discharge delays. Tell me about it.
Right. And her philosophy was really interesting. She said, stakeholders aren't obstacles, they're your team.
Ooh, I like that. Shifting the mindset. How did she put that into action?
She did this thing she called a stakeholder cafe. Basically informal chats.
Like literally coffee.
Maybe. But the idea was open discussion. She brought together discharge nurses, doctors, billing clerks, even patients.
Patients, too. Wow.
Yeah. And these conversations unearthed things like last-minute billing snags or problems arranging patient transport things that were holding up discharges but maybe weren't obvious to, say, just the clinical team.
Again, finding those hidden bottlenecks by talking to different groups. What about getting the higher-ups on board? That can be tough.
True. Dr. Roddy said it took a mix of data and storytelling. The numbers on delays were important, obviously.
We could have the data.
But what really hit home with senior leaders was sharing specific patient stories. Like she told this anecdote about a diabetic patient stuck for hours extra just because of some billing mix-up.
The human impact. That makes it real.
Exactly. It moves it beyond just numbers on a spreadsheet.
That's powerful. So what advice did she have for, say, a team just starting out with QI and stakeholder engagement?
Pretty straightforward stuff, really. Engage early, don't wait, listen actively, and try not to get defensive when you hear criticism.
Easier said than done sometimes.
Oh, totally. And crucially, celebrate all the contributions. Make sure everyone, even non-clinical staff, feels their input is valued. It builds that shared ownership we talked about.
Engage early, listen openly, celebrate everyone. Good advice.
Okay, so stepping back from the specific examples, let's look at the bigger picture again. Why is this stakeholder engagement just so vital across the board for QI in healthcare?
Well, pulling together everything we've looked at, it's clear that effective engagement is just foundational. It's the bedrock for projects that succeed and actually last.
Foundational how? What does it enable?
It enables real collaboration. You get teamwork, shared responsibility, and you make sure the project actually meets diverse needs.
Okay, collaboration. What else? Better communication, which, as some sources pointed out, builds trust and keeps everyone informed. Hugely important.
Trust and transparency, yeah.
It leads to more informed decisions, too. You tap into that ground-level knowledge, identify the real issues, and develop solutions that actually fit.
Smarter solutions.
Right, and it boosts sustainability. When people feel involved, they're more invested in making the changes stick long-term.
Makes sense. Less likely to revert back to old ways.
It also helps you spot barriers early. You can identify potential problems or resistance before they become major roadblocks.
Proactive problem solving.
Exactly. Plus, valuing people's input builds trust and credibility for the whole QI effort. And, maybe most importantly in healthcare, involving patients and families directly helps you understand their needs better.
Which leads to a better patient experience.
Precisely. And finally, all that feedback you get. It's valuable data for tracking progress and finding new areas to improve.
So it's this whole cascade of benefits, really, all stemming from talking to and involving the right people. You mentioned a research study earlier that looked specifically at this.
Yes, a qualitative study. It was focused on understanding how stakeholder engagement, particularly involving patients, influences patient-centered outcomes research.
So research about engagement in research. A bit meta.
Yeah, a little, but really useful. They wanted to see how involving patients and others actually affected the planning and the doing of comparative effectiveness research.
And how did they study that?
They did a lot of interviews, talked to researchers and their stakeholder partners, patients, clinicians, policymakers across nearly 60 different studies funded by PPOR.
PPRI, Patient-Centered Outcomes Research Institute.
That's the one. So they got a really rich picture from lots of different projects.
Okay, and what did they find? What was the big takeaway?
Well, a major finding was that engagement wasn't just some add-on. It influenced basically all parts of the research, from design to execution. People described it as integral, a core part of the process, not just a side activity.
So it really shaped the research itself.
Definitely. And the influence wasn't static, it was dynamic. It changed and evolved throughout the study. Partners influenced things in different ways at different times.
Different ways, like how?
The study identified 5 main types of influence. The most common was redirecting. Partners might suggest shifting the focus, maybe looking at different outcomes that matter more to patients.
Changing the direction, okay.
Then co-producing. This was more collaborative. Partners and researchers working together right from the start, maybe on the study design itself.
Like true partners.
Refining was another type, making smaller adjustments, like improving recruitment flyers based on patient feedback to make them clearer.
Fine-tuning things.
Exactly. They also noted times of limited or no influence, where suggestions maybe weren't feasible or didn't get implemented for some reason.
Okay, so it wasn't always acted upon.
Right, which is realistic. And finally, confirming, where stakeholder input basically validated what the researchers were already planning, which gave them confidence. And most projects showed several of these types of influence happening.
Interesting. So it's a mix, big shifts, small tweaks, validation. And did this influence actually lead to better research? What was the impact?
Yeah, they looked at impact too. 5 main types emerged. First, better user-centeredness and acceptability. The research better reflected patient and provider needs.
More relevant, basically.
Yes. Second, improved study feasibility. Engagement helped make the studies run smoother, more on time and on budget.
Practical improvements.
Third, enhanced study quality. Input helped improve the actual research design, made it more rigorous. Fourth, better engagement scope and quality. The process of engaging stakeholders itself got better over time.
Learning how to engage better.
Right. And fifth, increased relevance. The results were seen as more useful and applicable in the real world. And importantly, both the researchers and the partners felt the effort was worthwhile because of these impacts.
Wow. That's compelling evidence from the research side backing up all the practical stuff we've discussed. How does all this connect to things like, say, hospital accreditation? Does JCI care about stakeholder engagement?
That's a great link. While our source on Joint Commission International, JCI, didn't explicitly detail their stakeholder requirements, their whole focus is global leadership in quality and safety.
Right, they set standards.
Exactly. And their emphasis on continuous improvement, teamwork, communication, building that culture of patient safety. It all strongly implies that stakeholder input is crucial. You can't achieve that level of quality without it.
It seems baked into the philosophy, even if not a specific checklist item.
Precisely. We even saw quotes from hospital leaders talking about how going through JCI accreditation improved teamwork and communication across their hospitals. That is, stakeholder engagement in action, improving how different groups work together.
Good point. What about other organizations in this space?
Well, Supremediq Consultancy helps hospitals with accreditation, like NABH in India. Their whole service depends on understanding the needs of different hospital stakeholders to guide them effectively.
Their business relies on it.
Totally.
Yeah.
And ESQA, the International Society for Quality in Healthcare, their global mission is promoting QI through education, sharing knowledge, supporting health systems. Again, that mission is fundamentally about understanding and responding to the needs of all stakeholders, patients, providers, systems to drive improvement.
So it really is a theme woven through the entire quality improvement landscape, from individual projects to global organizations. Okay, let's bring this home. For someone listening, working in healthcare, wanting to do this better, what are the key actionable takeaways?
Based on the QI playbook and everything else, I'd say three main things. First, map your stakeholders early. Use that influence interest matrix. Be strategic about who needs what level of engagement.
Plan your engagement. Don't just wing it.
Right. Second, talk their language. Focus on the outcomes that matter to them. Don't just use QI jargon. Frame it in terms of efficiency for admins, patient comfort for nurses, reduced risk for leadership.
Connect it to their priorities.
Yes. And third, create and celebrate shared wins, even small ones. Make progress visible, acknowledge everyone's contribution. It builds momentum and keeps people committed.
Map early, speak their language, celebrate wins. Seems doable.
So, wrapping up this deep dive, what's the big message we want people to leave with?
I think the core idea is that stakeholder engagement isn't just another task on your project checklist. It's really a mindset.
A way of thinking.
Yeah, it's about recognizing that involving people isn't an obstacle. It's actually the engine for success. It drives ownership, builds support, and makes sure the good changes you make actually last. Absolutely. So we really encourage you, our listeners, to think about the stakeholders in your own world. Who are they? What levels are they at? How could you engage them maybe a bit more effectively?
And maybe a final thought to chew on. Considering everything we've talked about, especially that research, are we really tapping into the full potential of all our stakeholders to improve quality and safety? Is there maybe just one small thing, one small change you can make tomorrow to start fostering better engagement?
That's a great challenge to end on, something practical to consider. If you want to dig deeper, definitely check out the websites for JCI, ISQA, and other QI organizations. Lots of great resources out there. Thanks for joining us on The Deep Dive.